The effects of emotional labor and anger expression on psychological well-being among psych-learners. Look at the PPT screen for this study. This is a descriptive survey study designed to identify psych-learners' emotional labor, anger expression, and psychological well-being, and determine the effects of emotional labor and anger expression on psychological well-being using a structured question. This study was targeted at a total of 216 nurses who worked for over 6 months of clinical practice in 16 domestic psychiatric hospitals. We could generalize it because we participated in research at hospitals all over the country without limiting the result. As a result, the scores of psychiatric nurse emotional labor, anger expression, and psychological well-being was 3.06 points, 23.04 points, and 3.41 points respectively. Psychological well-being was revealed to have a significant negative correlation with emotional labor, and anger expression its sub-factors, anger in and anger out, and have a significant positive correlation with anger control. The factors found to affect psychological well-being were anger in and anger control, which are sub-factors of anger expression, and mismatch of emotions, a sub-factor of emotional labor. Therefore, it is necessary to identify important factors that affect the psychological well-being of psychiatric nurses and develop strategies to reduce the intensity of emotional labor, especially mismatch of emotions, and effectively control anger expression. With the rapidly changing social environments, the medical world has also seen gradually increasing demands for patient-centered healthcare service, along with a higher need for healthy lifestyle due to changes in the concepts about personal health. Nurses play a pivotal role with regard to this as they account for about 40% of the entire medical staff. As the quality of healthcare service becomes higher, patients expect high-quality care from nurses. As for psychiatric nurses under special environments, they are required to adequately use therapeutic ego and therapeutic communication while providing nurse care, and also to control their own emotions. Consequently, they could be easily affected by others' praise and then suffer from a higher level of emotional labor than other healthcare workers, resulting in a threat to their physical and mental health and personal well-being. This leads to the deterioration of their psychological well-being. Hospitals and constantly provide nurses with training courses for friendly response and assess whether or not they use appropriate emotion expression and comply with the required code of conduct according to their ethical decision making to treat patients when facing a situation where an ethical issue is raised while they provide healthcare service. As hospitals tried to even manage and control the feelings of nurses, the nursing staff sometimes feel uncomfortable in the face of various regulations during clinical practice. According to the research report on the emotional labor of hospitals conducted on 360 hospitals in 2016, 97.9% of the respondents answered they experienced emotional labor. Anger, which is primarily and essential emotion for survival of a human being, is often experienced in interactions with others and has to be adequately expressed and conveyed in interpersonal relations. Yet the anger that nurses feel most often in the hospital setting has been reported as a negative emotion. In usual cases, how nurses display and release anger, which is deemed a negative emotion, has an effect on their psychological well-being. In addition, more than 90% of nurses experience verbal abuses as a behavioral manifestation. In particular, psychiatric nurses who are required to develop and control their own internal resources in order to help patients to improve their abilities and quality of life are exposed to more various stressful experiences. Psychiatric nurses are more likely to frequently experience a mismatch of emotions as they cannot release their feelings to the full and suppress the feelings in order to provide a high-quality healthcare service. Emotional labor and inappropriate anger expression, which are factors presumed to be associated with psychiatric nurse psychological well-being, were found to be actually associated with their psychological well-being. However, few studies consider psychiatric nurse emotional labor and anger expression modes with psychological well-being. Therefore, this study is intended to provide baseline data for improvements in the working conditions of psychiatric nurses and the development of nursing care service. By identifying the levels of emotional labor, anger expression, and psychological well-being among those working at psychiatric hospitals nationwide, and by examining the effects of emotional labor and anger expression on psychological well-being. This study is aimed at identifying the levels of emotional labor, anger expression, and psychological well-being among psychiatric nurses and determining the effects of emotional labor and anger expression on psychological well-being. The specific objectives are as follows. See PPT for specific purposes. All tools used in this study were observed and used by tool developers via email. It's an emotional labor tool. The total scores ranged from 9 to 45 points, and the higher the score, the higher the intensity of emotional labor. The tool consists of 3 sub-regions of anger control, anger expression, anger control, and equations each. Calculation of anger expression requires reverse calculation. See PPT for calculation method. The total scores ranged from 8 to 32 points per sub-factor, and it means that anger expression is positive as the scores of anger in and anger out are lower and the score of anger control is higher. Psychological well-being. This tool consists of self-acceptance, environmental mastery, positive relations with others, autonomy, purpose in life, and personal growth. The total score ranged from 46 to 230 points, and it means that the higher the score, the higher the level of psychological well-being. The collected data were analyzed using SPSS in 21.0. Please refer to PPT for information on how to analyze data. The levels of the subject's emotional level, anger expression, and psychological well-being are as shown in Table 1. The scores of emotional level were 3.06 points on the basis of 5 points, and when it comes to sub-factors related to emotional level, frequency of emotional level, intensity of emotional display, and mismatch of emotional showed scores of 3.35 points, 3.01 points, and 2.81 points, respectively. The scores of anger expression were 23.04 points out of 72 points, and 4 sub-factors related to anger expression, anger in, anger out, and anger control show scores of 40.16 points, 13.45 points, and 20.57 points, respectively. The scores of psychological well-being was 3.41 points out of 5 points, and for the sub-factors related to psychological well-being, the following scores were calculated. Self-acceptance 3.34 points. Positive relations with others 3.63 points. Autonomy 3.10 points. Environmental mastery 3.42 points. Purpose in life 3.59 points. And personal growth 3.43 points. The correlations among emotional level, anger expression, and psychological well-being are as shown in Table 2. Psychological well-being was revealed to have a negative correlation with emotional level, and there was also a negative correlation between psychological well-being and emotional level's sub-factors. Frequency of emotional display, attentiveness of emotional display, and mismatch of emotion. Psychological well-being was found to have a negative correlation with anger in and anger out, and a positive correlation with anger control. A positive correlation between emotional level and anger expression was confirmed, and emotional level sub-factors and anger expression sub-factors were also demonstrated to have a positive correlation with each other. The factors affecting psychological well-being are as shown in Table 3. The general characteristics showing the difference in psychological well-being were age, marital status, highest level of education, eligibility, position, total service year, week unit, working pattern, sleeping time, satisfaction with sleeping, and satisfaction with the current workplace. The score of psychological well-being was found to be higher with a lower score of anger in, a higher score of anger control, and a lower score of mismatch of emotion. The proportion is played by variables included anger in 30%, anger control 4%, and mismatch of emotions 2%, and the total exploratory power by a model was 27.0%, and the modified expiratory power was 25%. The results of this study are consistent with those of previous studies which demonstrated that the mean of pre-course of emotional labor was the highest, followed by attentiveness of emotional display and mismatch of emotions among sub-factors. When it comes to studies on emotional labor of other jobs, the score of emotional labor was found to be 2.50 points in those working for senior welfare centers and 3.61 points in those working in the service sector, which indicate that most of them experienced a mid or higher level of emotional labor. With recent changes in medical environments where many hospitals had been focused on customer satisfaction, nurses are more likely to be exposed to situations requiring the stimulation of emotion, leading to a higher intensity of their emotional labor. Psychiatrists in this study tended to display anger in the order of anger control, anger in and anger out. This suggests that they frequently used anger control as the adaptive mode in efforts to dominate, control, and manage anger, which are similar to the results of previous studies on nurses and on occurs in other fields. Anger out and anger in were dysfunctional, whereas anger control was functional among nurses. Therefore, it was revealed that when the levels of anger out and anger in became high, psychological well-being became low, but the high level of anger control led to a high level of psychological well-being. Psychological well-being was found to be related to life satisfaction. In this study, the factor found to have a greatest effect on psychological well-being was anger in. Psychological well-being was higher with a low level of anger in, a higher level of anger control, and a low level of emotional mismatch. Also, which dealt with psychological well-being and subjective well-being, found that self-acceptance and environmental mastery show a strong correlation among the factors determining the quality of personal life. Therefore, it is necessary to recognize the effects of anger display modes on relations with others and make efforts to express anger in an appropriate way. This study was not limited to several regions and was targeted at nurses working for psychiatric hospitals nationwide, and there was no deviation between working areas. According to the results of this study, education had a high proportion among the factors affecting psychological well-being. This suggests that those with a higher level of education are more likely to make efforts to comply with the required rules of conduct, thereby leading interpersonal relations in a more positive way. This study also confirmed the necessity of professional knowledge, attitudes, and skills cultivated in psychiatric nurses. Thus, it is considered necessary to develop and improve job performance through professional learning and training. In recent years, demanders' needs for healthcare services have become more diverse, and nursing care is no exception. The variable which had the most significant effect on psychological well-being was anger in a sub-factors of anger expression, followed by anger control, a sub-factor of anger expression, and mismatch of emotion, or sub-factors of emotional state. If negative feelings such as anger due to emotional labor, therefore are controlled, psychological well-being will be increased. Consequently, it is deemed essential to develop programs that ensure active education on emotional management and problem-solving methods to help effectively control negative feelings, along with specialized training tailored to the individual characteristics of hospitals.